Now, a few words about the accumulation of medical knowledge, or the half-life of medical knowledge. Starting from 1956, I have some quotations for you. Dr. Sidney Burwell, the Dean of Harvard Medical School, from him is quoted that he said, "My students are dismayed when I say to them half of that what you learn, what you're taught as medical knowledge will in 10 years have been shown to be wrong. And the trouble is, none of your teachers know which half." I mentioned this repeatedly in my presentations. But the Dean of Harvard Medical School was actually not wrong, because later many other scientists have mentioned similar quotations. The half-life of medical knowledge, according to one study in 2012, is guessed as to be 7 years in 2012. When we come to 2017, and there is another citation I can mention to you, where it says, today, the half-life of medical knowledge is currently about 24 months, 18 to 24 months. And it is projected that in about 4 years, that half-life will be only 73 days, only 2 months. So in 2017, and these 4 years already passed, actually. So I'm not sure how long the half-life of medical knowledge today is, but I guess that from an accumulation of the new research evidence, I can guess that it is very rapid. So we have to find a way to keep us up to date, to follow the literature, to follow the new developments. There is no other option to prevent becoming outdated. One example I brought to you related with coronary artery disease, which also shows how fast the medical practices may change. Until the mid-70s, beta blockers were completely contraindicated. Due to what? Due to the belief that they have negative inotropic properties, so they would slow down the heart, etc. And they were not used. In 1975, researchers described the successful administration of beta blockers in heart failure patients. So in 1975, 5 years later, you see that the practice is changing. Then later, all patients with systolic dysfunction were considered for beta blockers. So it became a daily practice. But recently, not so recent actually, but in 2012, it was shown that beta blockers conferred no benefit in preventing recurrent myocardial infarctions, strokes, or mortality in patients with stable coronary artery disease. So this is, I think, a nice example showing how the evidence is changing in medicine. And there is a reason behind that, why this is changing, because there is so many research and we always strive to find the best evidence. And the best evidence, the best is the enemy of the better, you know, there's this saying. So when you are capable of doing new and better research, you find out that the previous ones were partially wrong. And here you see once more how the yearly number of publications are increasing. This is from PubMed Medline. Yearly number of publications have become almost 100,000. So fast it is, a million. It approached 1 million, the yearly number of publications. And the total number, of course, is having a geometrical increase. When you look to the total, it is going up each year, becoming more than 30 million accumulations of publications in the PubMed, only in the PubMed. Yeah, and fortunately, we have the technology is also increasing, and we have new methods of collecting evidence and summarizing evidence and presenting evidence, thereby helping researchers, helping practitioners, doctors, nurses to keep up to date. And evidence-based medicine shall help you, if you have this information, it shall help you to understand and follow up the developments in the medical field.